Now, Uganda Debt Network is concerned about the state of transparency and accountability in the management of resources in Uganda's health sub-program. National health spending as a proportion of total government spending is estimated at 7% in financial year 2021-2022, and the total expenditure per capita is estimated at $36.9 compared to the minimum recommended $86 by the World Health Organization for low-income countries. Wadulo Mark Arnold gives us more.
We suppressed the government of Uganda budget by 40%. Basically, all that money was to go to fight COVID.
Civil society is concerned that Uganda's health sub-program is increasingly becoming donor-dependent, and this could stress the government's ability to address health emergencies, since 93% of its budget allocation caters for recurrent expenditures.
But even this 22 we are talking about in health sector, it is going to not delivery of services, but much of it again is handling issues of salaries and what the wage bill.
We also see other accountability concerns still raised in the Auditor General's report that highlights issues which have adversely affected the performance of the health sub-program, including overpayments and irregular expenditures, for instance, totaling to 920 million shillings for construction works of health center tools in local governments, but also says that about 209 million was made without providing breakdown for work items being certified.
The Auditor General's report for financial year 2019-20 highlighted the major sources of COVID-19 response financing between March 2020 and June 2021 as loans amounting to 4 trillion Ugandan shillings, grants worth 17.98 billion Ugandan shillings, but slow implementation of some programs has affected service delivery and has become expensive.
And therefore, we start struggling as we execute. We get roadblocks because somebody has not cleared them prior, and then the loan delays and we pay extra money. We have agreed no project shall we borrow for money until it is thoroughly studied and all have agreed on how the steps are going to be done.
Civil society recommends government to improve coordination of activities between Ministry of Health, local government, health facilities and district task forces.
So shift the negatory expenditures to productive sectors of the economy. You can also shift them to those sectors that touch the Ugandan, the least Ugandan, like the health department.
As the country addresses COVID-19 pandemic resource needs, government has been asked to step up its effort in mobilizing domestic resources to bridge the funding gap in the health sub-program, with key emphasis on development expenditure. Wadulo Mark Arnold, UBC News.